As the California coronavirus variant continues to spread across the Golden State and beyond, new research suggests that several vaccines should continue to provide an effective defense against it. The findings, published Wednesday in the New England Journal of Medicine, offer good reason for Californians to keep rolling up their sleeves as the vaccination campaign picks up steam across the state. "We're not expecting this variant to be a problem for the vaccines, so that's really good news," said study leader David Montefiori, a virologist at Duke University. The California variant is actually a pair of closely related fellow travelers known as B.1.427 and B.429. Scientists say they most likely emerged in the state in May, then surged to become the dominant strain amid the deadly holiday surge. They accounted for 56% of samples from California that were genetically sequenced between February 28 and March 13, according to the Centers for Disease Control and Prevention. They have turned up in every state in the District of Columbia, and have spread as far as Australia, Singapore, Israel and Denmark. The California strain is just one of several so-called variants of concern being tracked by the CDC. Others include B7, from the United Kingdom, the P1 variant from Brazil and the B351 variant from South Africa. They're threatening because they're more transmissible, more virulent or more resistant to vaccines than their predecessors. Scientists and public health officials aim to quash these variants by vaccinating the population as quickly as possible. Not only will that hinder their spread, it will deprive them of opportunities to gain new mutations that could make them even more dangerous. As these coronavirus variants have emerged and spread far beyond their places of origin, they've raised concerns as to whether the current crop of vaccines will effectively protect against them. That's because the variants have acquired genetic mutations that affect the spike protein, which the virus uses to enter and invade human cells, and which the vaccines use as a target. The fear is that the mutations could alter the spike protein so much that an immune system trained to recognize an earlier version of the virus would fail to recognize a variant, leaving a vaccinated person without any biological defense. So a team of researchers decided to put two vaccines to the test. They tested blood samples from people who had received the COVID-19 vaccine developed by Moderna or a vaccine candidate from Novavax that has not yet been authorized for use in the United States. Then they introduced engineered versions of viral variants to these blood samples and waited to see what kind of immune system response they elicited. The dominant strain in the US is called D614G, and it was neutralized by blood from people who received either of the vaccines. The California variant they tested, B.